other old generation. So a next care for a client, cardiac arrest. Now they've given you the chief complaint. I'm taking care of a patient who just had a cardiac arrest. At 200, a 36-year-old was found unresponsive with no pulse. If you see a patient with unresponsive with no pulse, what do? CPR when he collapsed. A CPR was started. That's what they're telling you. Was started at the scene. So he had a CPR done. The client was successfully resuscitated. So they brought the patient back in the emergency room. Still irrelevant. The client was intubated. He had central venous line. He needed a line for medication. That's all. At 21:30, an hour 30 minutes later, the client was transferred to the ICU. Okay, fine. Shortly after transfer, the client converted to VFib. Now we brought the patient back. Now patient has what? VFib. All that they've told you is irrelevant now. Now your brain should shift to what? VFib. You have a patient who has VFib. Code blue was called. They called code blue, okay. CPR was started. I told you whenever you have VFib yesterday, usually you need to start CPR before you shock them, even though you have to shock them. So they started CPR over 2 minutes and they checked the pulse and there's still no pulse. The client current monitor shows now, this question is funny. They tell you asystole is dead. This is the hardest. This is one of the hard ones that I saw. Like they're playing trick with your brain, and don't get trapped. Just keep on following what they're telling you. Patient has cardiac arrest. He came to the hospital, went to VFib. We started CPR again. Now it's asystole. What is the management of asystole? What do you do when you see a patient who has asystole? What do you do? Luckily, they give you option. They said, okay, complete the sentence below by choosing from the list. So you got to choose from the list. The next essential intervention, what do you do? If I am in asystole, then you click here like this. Do you give me epinephrine? You give me amiodarone, or you give them sodium bicarbonate? You've done CPR. What do? You give them epi. And then after you give them epi, what do? Do you defibrillate them? Do you resume CPR or cardioversion? Asystole is not a shockable rhythm, so you don't defibrillate. You see, they're trapping you, keep on trapping you. Asystole does not need to be cardiovert because it does not have what? Yesterday I said QRS complex. So what you leave with? CPR. And this is what you do with the code. Asystole, you do CPR for 2 minutes, you slam in epinephrine. As soon as you slam in epinephrine, resume CPR. And so we resume CPR. And then you submit your answer and you see there. That's how they will grade you. And this is the 0-1 rule. If you choose the wrong one, you get nothing. 0 point for incorrect answer, but they don't deduct anything from you. You don't lose anything. It's just like you get it wrong. I guess I freaked some people out. Sorry, but I just want you guys to see what is it. You know it, but the question is presented in different form. Just sit back, and if you have to take it, fine. I mean, just like sit back and take a deep breath. It's the same thing. It's the same thing. Nothing has changed. Okay, so I will just close this up, and then unless somebody have a question. It's called differential diagnosis, and I can explain it. I can make it easy for you, but you also have to let your heart rest in peace, and then say, okay, I got this. It's the same thing. Just follow what they're trying. When they take you to heaven, bring you to hell. You see, with this question, it take you up and down. Keep on chasing them. You say, okay, irrelevant. What they've told me, you keep on changing the scenario. I'm still going with what you're saying. In the end, the patient has asystole, and you just manage asystolic patient. Instead of them telling you, you have a patient in cardiac arrest and have asystole, what do? That's what they would have said the last time. But now they're trying to see what you know. And you know it, just like give it to them, you know. Don't let them make you feel like you don't know. Okay. Okay.